I am Dr. Benjamin Levy. I'm a thoracic medical oncologist at Johns Hopkins School of Medicine, and maybe we can just go around the room and introduce one another.
My name is Dr. Wally Kern. I'm a radiation oncologist. I'm the Chief Medical Officer for Genesis Care, and I'm also Professor Emeritus at Emory University.
Hi, I'm Michelle Ginsberg. I'm Director of Cardiothoracic Radiology and Vice Chair for Education at Memorial Sloan Kettering Cancer Center. And I'm also a Professor of Radiology at Weill Cornell Medical College.
Mike Lanuti. I'm a thoracic surgeon at Massachusetts General Hospital in Boston. I'm the Director of Thoracic Oncology for our Division of Thoracic Surgery. Also have an adjunct associate professor at Harvard Medical School.
I'm Ramaswamy Govindan, a medical oncologist with interest in lung cancer. I'm a professor of medicine at Washington University in St. Louis.
77-year-old with right upper lobe hilar mass, right hilar mass 6 centimeters, unresectable, poorly differentiated adenocarcinoma. The patient gets concurrent chemoradiation. Pretty straightforward here. More to Dr. Govindan. What is your chemotherapy of choice for radiation? What do you generally use? Do you ever use pembrolizumab concurrently with radiation? And then what is the role for durvalumab? 3 questions there.
So the first question is that what's the optimal chemotherapy to go along with the radiation treatment? So I have to commend Dr. Karan and his colleagues for leading this and settling this issue, at least in my mind, once for all. I used to be the champion for giving systemically active doses of chemotherapy like cisplatin and etoposide along with radiation treatment in the past, very similar to the regimens pioneered by SWOG. But then the Ortivoji group led by Dr. Karan and Dr. Bradley, that study clearly showed that looking at the high dose versus conventional dose of radiation treatment, the outcomes were just as good as anything we have seen. And so in my mind, weekly paclitaxel carboplatin with concurrent radiation is about as good as anything else. So these days, I only use paclitaxel carboplatin, the traditional dose of 50 milligram of paclitaxel per meter squared, and now carboplatin AUC of 2 on a weekly basis during radiation. I do not give any consolidation or induction chemotherapy. And after concurrent chemoradiation, I give durvalumab. I do not think there's any role for pembrolizumab concurrent with chemoradiation during this induction phase. And that is a subject of several ongoing studies. Until they show that A, it is safe, and B, it is effective, I don't think we should be giving concurrently with radiation treatment.
Good. So weekly carbotaxol concurrently with radiation, no role for pembro during the radiation, and then consolidation durvalumab for up to a year.